which are short-acting, you got controllers, which are long-acting, and you got the preventers. And then, of course, you can get a combination, as you can see. So you got the relievers, you got the controllers, and you got the preventers, and then the combination you can have of all these ones. So treatments for asthma fall into, categories of 4, as it were. Quick relief medication, as I said, the ones that relieve us straight away. The long-term control medications you have, and a combination of a quick relief and a long-term control medication. These are important. People who know about them will definitely tell you they know about these and how they manage to do them, really. Yeah. But there is something like biologics, but that is like an infusion. It's still in the works. It's not very common. And even if it was common, availability and, if you like, what's the word for it? Affordability and accessibility is another issue. And these are all things to consider, especially for our own parts of the world. So the doctor would recommend, as I say, a combination of the treatments. And of course, depending on the type of asthma you have, how old you are, whether you are, a youngster, maybe you are a child, and of course, an adult or an elderly person. And then, of course, you got your triggers as well to be taken into the consideration. And your treatment plan may also involve learning your triggers. That's important because that's the way you can monitor your symptoms carefully, and then you can take the necessary steps to, I'd say, stall or maybe lessen the frequency of the flare-ups. It's vital because that's the only way. The more often you get the flare-ups, the less likely you are to be able to maintain it. But if you are able to master it, like we do with other non-communicable diseases, then you should be able to live a meaningful life and a fulfilling life at that, So we talked about this already. So bronchodilators, as they are, they work within minutes to relax the muscles that are really contracted around the airways. And so the symptoms really dissipate and get better, and you feel a lot better with them, And then, of course, you have what we call first aid treatment. So when that happens, if you think someone is having an asthma attack, then, as I said, tell them to sit up, assist them using the inhalers, and if they have a nebulizer at home, they could use that, obviously, yeah. The dosage would vary depending on the medication, and check the instructions, you need to know how many puffs you need to take. And of course, if symptoms persist more than 20 minutes, and a second round of medication doesn't help, then you definitely need to be thinking about heading to A&E, preferably by ambulance. If not, then obviously the sooner you get there, the better, Long-term asthma control, as you can see, we talked about already. These medications are taken daily to help reduce the number and severity of your symptoms. And they don't manage the immediate symptoms of an attack. That's the difference. So the long-term are maintenance. The short-term are quick relief, And these include the non-steroidals, anti-inflammatories, Now, I know I said that non-steroidal, which is like aspirin and ibuprofen, but this one is steroidal. I want you to be mindful of the difference. The steroidal is prednisolone, hydrocortisone. These are the steroids, And then, of course, you have the anticholinergics. That is just a medical name, but what it means is like ipratropium. Some people know it as Atrovent, And then you have the long-acting ones, which are like theophylline, Cerevent, formoterol. Those who are asthmatic will probably know these ones. So there's a long-term ones. And I mentioned biologics. As I said, this is what we use, for severe asthma that doesn't respond to other medications and, and treatment by trigger control. So if you tried your trigger control and you tried the medications and they did everything possible and it hasn't worked, then of course they would consider using these biologics, So one of them is Xolair. You may have heard of it. It disrupts the pathway that leads to the asthma-causing inflammation. And there are 5 types of them. And these are things the doctor can talk to you about if at all you need them. There is something called bronchial thermoplasty. This treatment is where you have an electrode to heat the airway inside the lungs, helping it to reduce the size of the surrounding muscle and prevent it from tightening. It's minimally invasive. As I said again, affordability and availability is another issue. Then, important for you is what is an asthma attack. Now, we know that already, the symptoms you get, the hyperventilation, the coughing. Of course, with that, you panic, you get agitated. And with the hyperventilation, you get confused. And of course, with that, you panic. And when you panic, the heart rate goes up. It's as simple as that. And of course, when the muscles tighten around the bronchs, the windpipe and the airway, you get wheezing. If you don't get the air going into your lungs, you get that blue lips, which is a really, really dangerous sign. You don't want that to happen, So you need to be looking at what controls you have, what triggers you have, how you can manage it, what you can do first of all. And then, of course, do the short-term things or the immediate things to do. And then if those don't work, then you need them to go to hospital as soon as you can. You can look at the picture on the left. It tells you, if you look at the lady's face, you could see that she's definitely anxious. She's definitely struggling to breathe. You can see the pose. She's holding onto the hip in order to help to get the breath in. And you can see what the normal airway looks like. If you look at this, you would see that. That's it. Look at what it looks like. And when it's actually tightened, you can see that. It's like a noose around the neck, and you can see the inflammation. This is the mucus that is secreted, and so therefore, because of the tightening, it can't be secreted. And the lungs are meant for one thing and one thing only. This is air. And if anything heavier or thicker than air gets into the airway, then of course one thing happens. You begin to cough. You begin to struggle to breathe. You begin to wheeze. So this picture, I think, typifies exactly what a normal airway looks like and what it is when you have asthma. And again, you can see it on the right. It typifies it. You can see where it's quite nicely wide here. And then when it's constricted, you can see that it's swollen. And of course, the mucus is there. You can see it. So how do you prevent? Well, avoid your triggers. Reduce your exposure to allergens. Getting the shots. There are, believe it or not, vaccines for that, which they can give you. As I say, you need to discuss that with your doctors. And of course, taking the preventive medication that you need to prevent an emergency. Yeah, eating a healthy diet is absolutely important. Maintaining a moderate weight. Believe it or not, people who are overweight do tend to be more prone to asthma. If you're smoking, then quit smoking, And of course, you need to exercise regularly, but within your own limits. Remember that. It helps you. Don't overdo it because, as I say, if you overdo it, then you end up paying the price. Manage your stress as best you can, seek the help you can, get into the support groups and the rest of it. The nutrient-rich foods are absolutely vital in helping towards reducing the symptoms. But remember, there are food allergies as well, and this can trigger that. So whilst you are helping yourself with the nutrients, remember to avoid the ones that you're allergic to. So there's no cure for asthma, as we said already. There are treatments you can have to decrease the asthma symptoms, the lifestyle changes we talked about already, and the medications to improve that. If you haven't been diagnosed with asthma, but are experiencing the symptoms, wheezing, coughing, shortness of breath, then perhaps you need to be speaking to your doctor, who can then conduct the necessary tests and examinations and all that to actually help you determine whether you've got asthma or something else. And once you've been diagnosed, then at least you need to be seeing your doctor once a year at least, and obviously that would increase depending on how you are controlling the asthma or how the asthma is controlled. Call your doctor immediately. If you feel weak, you can't perform your daily duties, you have a wheeze or a cough that won't go away. Yeah, you need to talk, as I said already, we talked about this, talk to your doctor. You will determine the type of asthma you have, the triggers that you have that are actually worsening the control or getting the flare-ups more frequently. And of course, what daily treatments are best for you and your treatment plan for the asthma, because this is what the key is to help you going forward and living a fulfilling life, even though you've got asthma. Take-home points, right, this is it. Asthma is a condition that inflames the lung and makes it difficult to breathe. It can affect both the children and, of course, the adults in different forms and different levels of severity. There are different medications available to treat asthma. The most common treatments are the bronchodilators, salbutamol, the inhalers, which are short-term, and of course you have the long-term ones, which help to maintain going forward. The lifestyle changes may also help to reduce asthma flare-ups. The diet changes and all the rest of it are important. This is just telling you about the healthcare providers and the severity of the asthma going up in the grid. If you look at the pyramid, you'd see mild, this is what it is, moderate, this is that, severe, and of course, the life-threatening. Now that one, you definitely need to be in a hospital, sometimes even in a ventilator, because if you do not do that, that person will expire. No questions about that. So these are my references if you want to, go to them. And of course, thank you so much. And I'll stop here and probably entertain as many questions as I can. Thank you kindly for having me.
Massive thanks, Dr. Kamara, as always, for this insightful presentation. I think we're going to go to, questions in the chat box. So once again, if you have a question, feel free to put it in the chat box. Other than that, you can use the raise hand feature, and I will give you an opportunity to ask your question. So, Doctor, there's a question in the chat box. You mentioned of developing country being affected, by asthma and the sort of death from those. And this person wants to know if there's a particular reason for that. And then the second thing is why asthma is very common among Black people.
Well, I mean, I don't think I have the statistics in terms of why it is that we have, or we as Black people, are more prone to that. But clearly, if you look at the socio-economic, structure, you would see that the likelihood of someone living in a moldy environment, is more prevalent in our people who are living under the poverty line, if you like. Yeah. And of course, the fact that the medication do cost a lot. And so availability, like I said, is one thing. Affordability is another thing. And of course, the expertise is another thing. So you've got a few things here. It's not just one factor, it's multifactorial. And I don't think we'll be able to do justice to it, as it were. But imagine, not wanting to digress, for other things that like vaccines and things that we actually talk about, where, or medication, for example, like HIV and the rest of it. Because of the fact that it's not affordable, obviously the trend is a lot worse in our parts of the world in comparison to here, where it is a bit more, affordable. So because it's free, as it were. So it goes to show you where it's affordable, where it's available, where it's accessible. Obviously, people tend to fare better in comparison to where it is there, available and accessible, and of course affordable. It's just a standard thing. If someone's got an asthma attack and you don't provide the inhaler, clearly they worsen and they go into mild, moderate, severe, and of course life-threatening, and they're still not there, then obviously they'll expire. So therefore, the chances are you would fare worse if it's not available because you can't afford it. You see what I mean? Or it's not available because it's not there. So there are environmental factors, obviously. Where there's industry, there's an increase, there's a rise. There's no questions about that. And you find most of our people are the ones that are actually in that kind of situation, as it were. I don't know if I'm making any sense, but it's not something that you'd want to say you pinpoint to one point or one particular factor. It's a multifactorial thing, and involves a lot of politics as well as, medicine, as well as factors that are humanitarian as well.
Okay, thanks, Doc. I think I'm going to bring in Stephanie, and then, we'll go back to more questions in the chat. So Stephanie, do you want to unmute?
Thank you very much. Thank you, Doctor, for the information about asthma, because there's not so much information around it for people to learn from it. So I just wanted to ask, because you made mention of so many factors that can contribute to asthma. Initially, I thought asthma was only something you can get from childhood, but you mentioned getting it even in adulthood and so many factors that can trigger that. So I wanted to know, there's something you said that's almost similar to something I came across, which is called cystic fibrosis. So this cystic fibrosis, does it mean someone who has cystic fibrosis is susceptible to asthma? And then another question is, there is this procedures people do that they try to clear the airway for patients with cystic fibrosis. If you do the same thing for someone who has asthma, will it work?
Well, I think you're alluding to the physiotherapy. That trying to expectorate
Yes.
the mucus. Is that right?
Yes.
Now, you see, as I mentioned, I said the difficulty with asthma is that on any airway illness is that it's not something you would say this person has got typical asthma without actually some added information. This is why when someone comes to you, you can't speak to them because they're struggling. All right. So what you have then is an issue where you have other factors coming in. This is where you need your collateral history. So if this person is coming in as an asthmatic already, there's a flare-up. But if someone comes to you with angioedema, or someone comes to you, I don't know if you know what that is, where the mouth and the tongue swells, or someone's got anaphylaxis because they use the medication they're allergic to, and now they have an emergency response to it and the throat swells, or someone who's got hereditary angioedema, which is something where you have it in the family, but it only triggers when something happens. So they all come in with one problem. They're having difficulties breathing. So the cystic fibrosis as well, difficulties breathing. Sometimes people with sickle cell, when they have the chest syndrome, difficulties breathing. Somebody with pneumonia, difficulties breathing. Somebody with COPD, difficulties breathing. So all of that, they're all presenting with the same symptom. You see what I mean? So as a doctor, you now, especially an emergency medicine doctor, you there now tasked with actually identifying which is the most likely one. You don't have time for that. What you do have time for is relieving that obstruction in the airway. And one way of doing it is by giving the nebulizer. While you're thinking about getting the history, getting all the things that would help you to narrow the diagnosis. But certainly with cystic fibrosis, it's a different pathway altogether, because this is something that happens because of the fact that you lack something in your body, and that is giving rise to that secretion that is blocking the airway. You see what I mean? And therefore, the need for it to be brought out by doing this physiotherapy. That's a different thing altogether from the asthma. The asthma is more to do with the narrowing, the constriction. And then, of course, because of that, there's the inflammation, and the inflammation leads to secretion. The secretion further makes it swell. And then, of course, there's like a catch-22 situation. It's narrowed, it's swell, and it's producing this mucus, which is actually worsening the breathing, which is the end product of what you have with the cystic fibrosis. So the sooner you then apply what is required for you for asthma, as opposed to for cystic fibrosis, then of course, the better it is for you. But it's not something you would do immediately because they're struggling to breathe. And that's what you need to do. Remove that breathing problem, and then you can then address the appropriate problem that you're facing with, especially if you think about cystic fibrosis. I hope that's clear.
Yes.
Okay. Thanks, Doc, for that. A couple more questions. Someone is saying, are there certain foods that can trigger allergic, attack? And are there foods that can also help a person manage, allergies, such as hay fever? And
oh yes. As I said, I think it was my last or second to last slide, where I said the foods you eat, obviously. Like, for example, for me personally, if I eat something like pineapple, it scratches my throat. So I tend to avoid that. You see what I mean? Some people will take joy in eating that all day long. I can't do that. So you need to know what is good for you and what is not good for you. Pineapple is full of antioxidants and things and all that. But in doing so, I will be exposing myself to another issue. So therefore, I would try and eat less of it as possible. So you would need to know what it is that triggers, what it is that causes the problems. The foods might be good, but not for everybody. So what is good for you, I'd stick to. What is not good for you, I'd leave as best as possible.
Okay, thanks, Doc. And there's a comment in the chat. This presentation has been very informative. This is the first time I've had this subject explained so clearly. And I'm HCP with asthma. Should your GP or asthma HCP invest time identifying the type of asthma one has?
100%. Thank you so much for the comment. Please, when you're presenting, you always want to get the feedback as to what you're doing. And that is really good because it gives you an idea as to what you're doing, what you're presenting, and how effective you are in terms of presenting. Because as I say, the key thing, the reason why we're doing these talks is obviously, creating the awareness, sensitizing our people, making sure they don't, become injurious to themselves. It's important that because some people have this thing, they don't know they have it. And so if you know about it, then I think, and you hear it from your own kind of person, I think you'll adhere to it. And that's the important thing about it. But believe you me, when I tell you, every person who's got asthma, I'm not talking about the one who's got it mild or maybe seasonal or something, but if it's moderate to severe, you should have at least once a year visit with the GP or the asthma specialist nurse. There's no questions about that. So if it's not happening, then it needs to be happening.
Okay, thanks, Doc. I have seasonal rhinitis, and 1 year I had a severe attack from pollen and was not warned about how to manage my symptoms. I was not diagnosed as asthmatic, but wondered whether I should be taking inhalers during the hay fever season.
I mean, like everything else, the inhalers, if they're not for you and you use them, obviously everything has got a side effect, as you know. So the allergic rhinitis, the inhaler would only be helpful if at all you've got symptoms with the breathing. Are you with me? And because that's what the bronchodilator is there for. It helps open the airway. Now, if you're taking it because you have problems with runny nose, red eyes, itchy, that's not what the bronchodilator would do. If anything, you need antihistamines. And like I said already, there are injections, there are shots that you can take, but that would be organized by the GP. They have to go through a very thorough process of actually trying to find out exactly what it is and which it is that you are allergic to. If it's just, you go to the allergy clinic, they would definitely be able to narrow that down, and they'll do all the various tests and get down to what it is that you're more likely to. If it's nickel, if it's feathers, if it's mite, if it's dust and all that. And then, of course, they will tailor your treatment or your management to that. Now, I know there are certain people who have got that perennially, i.e. all year round, they've got that. So such people, I know, are getting injections. So when it's getting to the point like we're getting to this season now where the pollen count goes high, they get the injections like around March, so it kicks in, it builds into the system, saturates. And so by the time May, June comes in, they then, are in a better position to manage themselves and improve with their symptoms and, stall or maybe reduce the frequency of the flare-ups. That's one thing that helps. Again, it's management. So therefore, you need to be keeping in touch with your nurse, who is a specialist in that, to be, if you like, organizing a bespoke management plan for yourself. And that is something that would stand you in good stead. There's no questions about that.
Thanks, Doc. Lots of positive comments in the chat about the presentation. One says very informative presentation. Given the connection and the dangers with housing you outline, what more can be done to mitigate, and to ensure something that's practical and affordable?
Well, this is it. We need not be quiet. We need to actually, be vociferous in making this known. I remember the poor, such a tragedy, the little one that, that the boy, what was his name? I think, was it 2-year-old, maybe a year or something?
Yeah.
And that was, it just got me. I really was besides myself, looking at that poor lad living in a situation and premises where it's not fit for living, and they ran away and came to somewhere where they thought they were seeking sanctuary, and all of a sudden to face their death like that, such a tragedy. It's just unbelievable. So we need to be making these noises. We need to be making sure the authorities actually understand that, look, if the conditions are not for living, then obviously they need to be improved. The councils, the landlords who are, renting out these properties, they need to be held to account. they need to be scrutinized, to stand up to scrutiny, because a lot of them, all they do is take the money. And then the premises disintegrate, you just dilapidated conditions that we live in. And in the end, we pay the price. So people pay the price, and therefore it needs to be highlighted. And if needs be, I dare I say, criminal proceedings need to be, brought, to people who are found guilty of violating the rules and regulations. They're there for a reason, because you save lives, you prevent. As I say, if you look at the burden, the impact it has economically, the number of times that you have to be repeating this, these medications, these prescriptions and things like that in the year, and imagine millions of people, and the lives you could have saved, and the impact on the economy, all of that needs to be brought into, to play in this particular situation. And so we need not tire. We need to be making sure people are aware of this and move forward with that. That's the least we can do, just make them aware that these are your rights, these are some things you should have, and therefore pursue them as best you can.
Yeah, thanks, Doc. Without putting him on the spot, it's great to see Clyde. In London, we had a meeting yesterday, and he's hearing you loud and clear, one of the non-exec directors, at Bart's, hospital. So great to see you, Clyde. And if you want to say any few words, not putting you on the spot. Someone has said, I've noted that my asthma became worse since having COVID. Is there any correlation or research showing the prevailing factors with people from the African or African Caribbean background?
It's interesting you say that asthma and COVID. Now, if you note, the GPs would have been actually asking you to, if you like, shield, because asthma is deemed as a high-risk illness. And especially if you have yours as severe or moderate, you need to obviously make sure again, I keep saying it's management. I think it was Benjamin Franklin that once said, failing to prepare is preparing to fail. So you've got asthma, and nobody should be more interested in it than you are. Therefore, you need to be knocking on those doors, making sure that your plan, is bespoke. And so therefore, you need to be sorted out. There's no questions about that. So the only way of doing that is by you being proactive, by you being enthusiastic about it. Indeed, because COVID affects the chest and asthma affects the chest, then there definitely is a correlation. So you fare worse because you will get the shortness of breath. You will be prone to infection, and the immune system will be weaker. So therefore, recurrent infections will definitely be something that will trigger the asthma. There's no questions about that. People who got asthma are prone to pneumonia. And we know COVID is pneumonitis, and it's a cause of death. And if you have asthma and you have COVID, clearly, there's a correlation there. There's no questions about that. So therefore, you need to be proactive. If you were supposed to be attending the long COVID clinic, then please attend that. But that is something that would come from, a myriad of tests and investigations and analysis for you to be able to be put in that category. Remember, once you put in that category or you labeled, it becomes a problem to be delabeled or unlabeled, that's the expression. So you need to be proactive. Seek that, and I'm sure you'll get it.
Great. Doc, one more question, and I'll bring in Clyde. If you have asthma, do you need to pay for your inhalers like other prescriptions?
I'll be honest with you, I am not sure whether there is a dispensation from the government that people who are afflicted with asthma should be exempt from paying for it. I don't know. I must admit, because I don't know how these things work. I don't work in the pharmacy, so I just prescribe it and then go and get it. Now, whether they're exempt, I'm not sure, but I'm sure if you're 60 and above, you definitely be exempt. If you're pregnant and you've got a chronic illness, perhaps I think you are exempt, but don't quote me on that. It's something that would need to be looked into, really. Yeah. But I'm sure the pregnant women, people with diabetes, sometimes have to be exempt from certain medication. But definitely 60 and above, clearly you're exempt. And so somebody else might be able to, answer that in a better manner. But I think it needs to be looked into, really. Yeah.
Okay, thanks, Doc. I'm going to bring in Clyde, and then we go back to the chat box.
Thank you very much, Charles. And Doctor, you have done such a fantastic job in taking this complex message and making it accessible to all of us. I actually have a child who actually suffers from asthma, and I wish I had this kind of information as she was actually growing up. One time we were about to go off to South Africa, and she had a really bad attack, and we rushed down to the hospital, and we were asking them, can we actually fly out tomorrow? And they weren't in a position to actually advise us one way or the other. Fortunately, we actually went on our trip, and she didn't experience asthma whilst we were away. But I think the information that you are providing, we must find a way of getting this information out to more of our people. Thank you very much.
Thank you for that, sir. I'm grateful for the comments and the positive remarks. Thank you so much. It just goes to show that, it's indiscriminate. That's the problem with it. It doesn't matter whether you are rich, poor, or in between. If you've got what it takes for the asthma to flare up, that's what it is. And as I say, normally what tends to happen is when you come with an emergency, like a flare up, as I said, there's mild, there's moderate, there's severe. Now, what tends to happen is most of the times when the parents come to us in the hospital, they're very sensible because they know the illness. So what they'll do is they give you the puffers, they give the child the puffers up to 10, and then keep an eye and see whether they get better. And most of the time, they give them like a transient relief or reprieve, if you like. And then because, the allergen or maybe the offending, agent is still in and it's very powerful, they then start wheezing again. So even though we say you give the inhalers, we always say keep an eye on them. And this is why probably they couldn't tell you whether you can travel or not, because they would have seen the effect. And if it's transient, then you probably need to top it up. But then most of the times when they come in, we treat them as we should, we get them sent back home. There's no questions. Because the steroids, believe it or not, are very important. The sooner they go in, the sooner they start acting, and the better the output or the outcome, if you like. So they should give you those for like another 3-4 days. If there's an element of an infection, they should give you some antibiotics as well. But the inhalers are the mainstay. So steroids, antibiotics if necessary, and then the inhalers. And I guarantee you, you can fly. There's no questions about that.
Great. Thanks, Doc, and thanks, Clyde, for sharing that experience. And with saying, you talk about making sure we can get the message out. I remember very well, and it goes back to the previous question that someone raised about COVID and, the asthma. I remember very well, March 2020, just around the time of the lockdown, because, of one of such sessions and a colleague advising that, people with asthma and underlying health condition, could fare worse. I asked my son to stop going to school, way before, government. So we need to take responsibility for our health. It's so, so important. Doc, another question. I have systemic lupus again. My asthma, which was really an issue, so it's been at level 1 for the last 30 years, has become worse. Could my autoimmune condition have an impact?
Undoubtedly, there is an element of that. I mean, lupus, as you know, is autoimmune and it can affect different systems in the body, including the chest. There's no questions about that. As I say, when people have these chronic illnesses where the immune system is actually tasked and really bombarded, the one thing that would actually cause problems for them, and sometimes is the cause of the demise, is the complications of the chest. It's as simple as that. So therefore, we always look at that to say, I tell you what, the only organ that actually communicates with the outside world, so the organs in the body, the only one that communicates with the outside world at least 18-20 times a minute are the lungs. So therefore, they're very prone. And so definitely, if you don't have a robust immune system that would help you to cope with all the bombardment over the allergens or the offending organisms, be it virus, be it bacteria, be it fungus, and any other thing, you obviously succumb. So therefore, 30 years it's a good time in terms of control. So as you grow older, as we know, the immune system is not as robust as it was 30 years ago. So therefore, you need some support, you need some help. And so therefore, there is the business of needing to be assessed by your lupus nurse, specialist nurse, or the rheumatologist who deals with that, with a view to making sure that even though you're getting older, but you still are able to maintain the immunity to last you as long as it can. But it's important, as I say, managing it and making sure that it's bespoke to your needs.
Thanks, Doc. One more question. So earlier on, he asked the question and we referred HCP, obviously healthcare professional, but he's actually a paramedic. He said, I appear to have multiple triggers, but would place myself in the mild category. One thing I've noticed is taking my prohibitor steroid inhaler daily has controlled my symptoms much better. And according to Nev, his understanding is you pay for your inhalers, but
yeah, that's what I'm saying. Yeah. I don't think there is an exception except you get to 60 and things, but yeah, it's a good thing that, as I said, that's the key thing, knowing what you have, the type, how you manage it. And that way you can stall the flare-ups, you can, reduce them. And that way you lead a better life, a more fulfilling life. There's no question about that, because I tell you what, it's a frightening experience when that happens. You get that pending feeling of doom, and you don't want that, because it's a vicious circle then, because you panic, because having the possibility to breathe, and then one thing leads to another, and then of course pandemonium strikes, and then it becomes really, really crazy. So therefore, the less of it you have, the better it is for you. And I'm glad he's actually making the statement that I really like. He's saying, my control is better. And that's what we like to hear. As clinicians, that's what we want, because we want people to be able to manage the issues. It doesn't mean because you have asthma and it's incurable, that means it's a life sentence. No, as I said, I've seen people make money even though they're asthmatics. They're millionaires, there's no questions about that, but they managed it better. And they stayed from the triggers. And when they had it, they knew what to do and made sure it was clawed back to their baseline, which is the key. In any chronic illness, it's how you control it and how you manage it. And when you get the flare-ups, how you claw it back to your baseline is the key take-home message.
Great, thanks, Doc. Another positive, feedback from one of our community leaders, Elizabeth. Doc, you are a blessing with these responses. I've learned more in the last hour and how I've done in all my years with asthma. Thanks so much. So really positive, from one of our community leaders as well.
Thank you.
So the last question for you, Doc. But then next week, guys, we're going to be back here, the same joining link. We're going to look at PTSD and how that impacts on, Black children. So once again, it will be an informative one. But the last question, I'm worried about my asthma, which is not well controlled despite taking blue and brown inhalers. I was a regular in A&E when I was younger. I'm now in my 30s. I feel so tired a lot of the time, especially when I get shortness of breath and all of the wheezing and coughing. Am I more at risk of things like pneumonia? Do you think I need another assessment?
I think the question is self-explanatory. As he said, do I need another one? Well, clearly, if you are feeling tired, I think if one of my slides alluded to that, if you're feeling more tired than you are usually, that's a sign for you to be making, a visit to your specialist nurse, booking an appointment, making sure that is, A&E, okay, fine, you come, what we can do is just give you what you require at that point in time, to just stabilize it and get it back to probably your baseline. If you're not getting to your baseline, then obviously, we'll have to then refer you for further management until you can get to the baseline. As I said, it's a phase thing. But if you know yourself better than any doctor, yeah, and if you're not responding to the treatment that you've been prescribed or administered, like you say, the 2 inhalers are not working, yeah, so therefore you need that visit to the specialist nurse or the respiratory consultant, or maybe the GP, to see what suits you better, what it is they can do to just nudge it up a bit so you can live a better life. In your 30s, that should not be happening. And so therefore, my advice to you is to go there. If it means you have to phone before 8 o'clock in the morning and be on the queue there until 8 o'clock, then you're the first in the line, please do that, because your life depends on that in terms of how you fare. But if at all that's not helping, you can come to A&E and we can then refer you to the respiratory team. I'm sure they will see you, assess, and decide which best suits you. Again, bespoke. That bespoke management treatment is what you need.
Great, thanks, Doc. There is a survey link that has been posted in the chat box. Adama, we've noted your comments. And Dr. Kamara, we may have to bring you back to do one session on COPD because there's a request and, a real interest. And yes, if you drop us an email, health@CAHN.org.uk, we will send over, some slides. But, this session has been recorded. It's on our YouTube channel. You can get the link as well as, various sessions. Really looking forward to the 2nd of May will be 3 years since we've been running this every Saturday. So we're so grateful for, Dr. Kamara and his colleagues that come on Saturday after Saturday, apart from the 2 weeks we have off, over Christmas and New Year. And it's such incredible. My health literacy has gone through the roof. And sometimes people call me doctor. I say, no, I'm not there yet. I don't want to get into trouble. But Dr. Kamara and your colleagues, we're extremely grateful to you. Please, the cost of living crisis, there's a, link in the chat box. We want to understand how that is impacting on our community. Lots of millions in household support funds and others. But we know within our community as well, there are people without recourse to public funds, some real challenges. And then we want to understand even when people are entitled to support, how does that manifest and translate? So please complete the survey and let's get some rich data out there. So next week, we will see you same time, 11 o'clock. We're looking at PTSD, post-traumatic stress disorder, and how that impacts on, the Black child. And yeah, so final words, Doc, and I'm going to hand over to my colleague to, wrap up with some announcements. Once again, CARIB is brought to you by, CAHN and our partners, Croydon BME Forum, Rafa Development Agency, Enfield Caribbean Association, Black Health Initiative, and then the RCCG Royal Assembly in Sheffield. Doc, any final words from yourself?
I think there's a hand up, is it? There's a Brima or something?
Oh, okay. Yes. Brima, do you want to unmute and then ask your question?
All right, it doesn't.
Okay, accidental one. Okay.
Right. Okay. Well, thank you so much for having me, and I'm pleased to hear that this has been well received. The comments, obviously, and for you wanting to invite me for another session, it means I'm doing something. Now, for me, the important thing, as I say, is for people to understand that being diagnosed with something that is chronic or something that is, you would say lifelong or whatever, does not mean it's a death sentence. I want people to understand that. It's vital that once you get that, you then realize, oh, hang on, I need to develop the coping strategies, the coping mechanisms. And how do I do that? With the help of, my doctor, my specialist nurse, and of course, my family, which is vital because these chronic things impact not only you, but it impacts the family life and of course your colleagues and wherever you are. So they need to change with you and you need to change with them. And it's a combined thing. And the only way of achieving that is by knowing what you have. So when you know what you have, you can deal with it better. Asthma kills, but it only kills when it's not looked after. So therefore, look after it before it takes care of you. It's important that you keep that annual review. And of course, if there's things that are worsening because of one thing or the other, A&E is always at your rescue. Yeah, do what you need to do, maintain that status quo, do what you have to do in terms of going forward, and I guarantee you, your life will be more fulfilling than maybe you would have said if you didn't have it. So thank you very much for having me, but we need to be making people aware and we need to sensitize our people to say, look, do what you need to do in order to make sure your health is number one. Thank you so much for that.
Thanks, Doc. Once again, we're extremely grateful and we look forward to having you back for COPD. Once again, the other thing to mention is for all the clinicians, the doctors that present on here, they are happy to offer, you know, impartial second opinion. That's so important. So, you know, they're happy to speak to you over the phone, informal, at no cost to yourself. And they are part of our community. And we want you guys to utilize them so that, you know, our community will be a lot more healthier. Massive thanks, everyone. And over to you, Daniel Wama, you know, our head of finance at CAHN, to give announcements and close us.
Right. Thanks, Charles. And massive thanks to Dr. Kamara for this informative session on asthma. Thanks so much, Doctor, for sharing your wealth of knowledge with us. As usual, you never disappoint, and we're grateful to have you on this platform. Thanks a lot. Massive thanks as well to our wonderful chair, Charles Kwaku-Odo, who's also our chief officer, for hosting this session in such a brilliant manner. Thanks a lot, Charles. A big thank you to our CAHN partners and all our attendees on Zoom, Facebook, and YouTube. You can actually access Dr. Kamara's slides for today's session by emailing health@cahn.org.uk. Okay, so we've got some exciting upcoming announcement for you, and please stay tuned. Can I have the slides, please, Praise?
All right.
Great. Great. Okay. So we are back again next Saturday for our CAHN Health Hour session. Same time, same link, and the topic is post-traumatic stress disorder and the Black child. Please register for this session by emailing events@cahn.org.uk. Next slide, please. Join us next Tuesday from 6 p.m. to 7:30 p.m. for our Healthy Heart session. The guest speaker is going to be Dr. Hiba Osekwesi, who is a registered nutritionist. And then the topic is going to be eating to prevent and best manage anemia. Next slide, please. CAHN is offering family and advocacy support session, and you can be part of this session by emailing advocacy@cahn.org.uk or call 07710 022 382. The number again is 07710 022 382. Next slide, please. We're also offering a bereavement peer support group session, and you can actually be part of this session by emailing roslyn@cahn.org.uk or help@cahn.org.uk or call 07710 022 382. It's actually ongoing and it's going to end on the 17th of July, 2023. Next slide, please. Next slides. All right, so join our physical activities. No, please go back again on the physical activity. Join our physical activities and well-being club by emailing paulclub@cahn.org.uk or call Orlando on 07464 317 635. Next slide. CAHN is also offering a green and arts well-being services, and you can be part of this by emailing green and arts well-being @cahn.org.uk or call 07789 975 205. And the number again is 07789 975 205. Next slide, please. Next slide, please. Next slide.
The slides is on. Can you not see it from your end? The slide is on. Can you see it? think it's having a network issues. All right, I think I'll go in. So we have this Van CAHN campaign. It's about prostate cancer, and on Tuesday, the 4th of May, from 11 a.m. to 3 p.m., NHS staff will be at Asda offering free PSA blood tests. So to get more information, you visit the link showing. Then the cost of living crisis, the cost of living survey is still ongoing. To take part in it, you can scan the QR code on the screen. And for more information, you can email research@cahn.org.uk. Then you can also call the number 07853 556 591 or 07859 154069. Then special thanks to all our partners and to the MFIT Caribbean Association and Rafa International Development Agency and the Redeemed Royal Assembly Church of God and Credit BME and Black Health Initiative. So thank you all for joining today, and see you all next week. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.